Good day all. Let's go over some exercises for low back pain. Exercise number 1. Abdominal bracing. We're going to start off with an exercise called an ab brace. This exercise targets the deepest abdominal muscle you have. It looks like a flat sheet that wraps from your spine all the way to your stomach. To perform this exercise, lay on your back just like Mom N is doing with your knees bent up and feet on the surface you're laying on. If bending your knees causes too much pain, then just straighten out your legs and let them be flat. Whatever is most comfortable for you. Next, pull your belly button down and in towards your spine. You should feel your stomach sink. In a good way to check yourself is go deep as we can go, so you should feel your hands sink into your stomach. She's going to hold this ab brace for 5 seconds and then slowly release it. You can perform 3 sets of 10 repetitions to start. Okay, next exercise number 2. Pelvic tilt. We're gonna do a pelvic tilt. It's a great way to engage your core muscles and bring your spine into a more neutral 1202 and supported alignment. So we'll start here again, laying on your back with your knees bent up. You'll press your low back down towards the floor and hold for 5 seconds. You can place your hands on your low belly and feel the muscles contract underneath your hands. You can repeat this for 10 to 20 reps, and a great progression of this exercise is to practice this in a seated or standing position. So maybe he's going to do a couple perfect form. It's like she does this for a living or something. Well, thank you. Alrighty, exercise number 3. Bridge. We're going to do is a bridge. This is to target your glutes and your hamstrings. Sometimes you may also feel this in your quads, in the front of your thighs, or in your back. We want to limit how much muscle contraction or pain you're feeling in your back as much as possible when you're doing these. So you're going to stay in this position, laying down on your back with your knees bent up. A cue I like to give to limit how much of your back you use when you're bridging is by pushing your knees out and away from you, and because you do that your hips lift up. That should help engage your glutes and those hamstrings more and prevent overextending your lower back. Good, perfect. To make this more challenging, you can hold for 5 seconds at the top. You can also march each leg off of the ground just like that. Good, and then wherever you come down you can even do a single leg bridge if you need even more of a challenge. Yeah, there you go, wonderful. So again, to start out, you can do 3 sets of 10 repetitions. Do whichever variation best suits you. Follow your symptoms, let them be your guide of how much you push yourself and how much you need to load and challenge your muscles. Okay then. Exercise number 4. Dead bug. Show you the next progression up. It's called a dead bug. You'll be laying on your back, same position, and we're going to raise both your legs up into a 90-90 position. Keep that pelvic tilt and that ab brace that we showed you at the start throughout the entirety of this exercise. You're going to start by slowly tapping one of your heels down towards the floor without bending your knee, and then slowly bring the leg back to the starting position, and you'll repeat this on the opposite side. Good, and come back up, and you can continue to alternate just like so. Good. Yo, we need a quick question from the field here. So candidates wanted to know if she can do these moves if they have a sway back or a curved spine, if these movements might be safe. So it depends on how intense your curve is, right? Like I was saying before, we want to make sure we're following your symptoms as your guide. The ab bracing and the pelvic tilt are a good place to start. If the dead bug feels okay, then it's alright to do. I would do the variation that we just showed. We're going to show you another variation, exercise number 5. The beg bug variation. The beg bug variation. Challenging enough for you, you can start to incorporate your arms into this exercise too. So then you would tap your heel down and then reach your opposite arm away from you and then come on back up. Good, and then Mom N would switch and do the other leg and the other arm. Perfect. Alternating like so. Doing slower, more controlled motions are ideal here to get that core stability. We're looking for it. Looks great. Exercise number 6. Planks. We're gonna do some planks. Alright, there are many variations of this very common exercise. Planks help strengthen your core and abdominals in this anti-extending motion. So we're going to set up with your forearms and elbows on the ground. You're going to keep your hands separated. And then you're going to lift your hips off the ground and your toes will stay in contact. Good, you want to keep a neutral spine and prevent sagging at your hips, right? So we don't want to do that where she's dipping down too much. Lift her stomach more off the ground and See how she's in a nice straight line. That's what we're looking for. Okay, you can take a break. Exercise number 7. Plank variation. Yeah, so another plank variation you can do is by going in the same setup, forearms and elbows on the ground. And then just keep your knees on the floor as well, and then coming up into the plank. This is going to bring the level of difficulty down 1. Good, perfect. And then another plank variation, exercise 8. Bear plank. A bear plank. You can put your hands on the ground, elbows stay straight. And your arms are in line with your shoulders and your knees are in line with your hips. Then you're going to lift your knees off of the ground. And then from there the 4 contact points you have are your toes. And your hands, make sure again while you're doing this, your knees stay in line with your hips. You come up into that bear planks. We can hold them for 30 seconds and do 3 sets of 10. Good, alrighty. Exercise 9. Cat camel. More for improving your mobility. Hands and knees in a tabletop position, let your belly hang down and arch your back to start. Then you're going to look down towards your belly and hollow out your back. Good, think about pushing your back towards the ceiling when you do this portion of it. You can also incorporate some breathing with this one, inhaling as you look down and exhaling as you look up. You can do this for 30 times, a good starting point. Perfect, great work, mom. Exercise 10, child's pose. Good stretch for his low back. We will be starting off with a child's pose, so it's a good way to stretch out your back muscles, spines and your lat muscles. So I'm gonna have mom kneel on the mat with his legs together. He's going to sit on his butt onto his heels. And he's going to let his chest move down towards the floor. Awesome, yep. And now he's going to walk his hands away from up towards the top of his yoga mat, exactly, so he's trying to maintain contact between his heels and his butt association for about 30 seconds. If you have more one-sided back pain, you can also bend your torso slightly to the side opposite of the one that's bothering you. Yeah, so mom here is leaning over towards his left side, so he's stretching out his right side. Good, perfect. And that gap will allow him to stretch those tight muscles on the affected side. So another one. Up next is another exercise 11. Thread the needles. Mobility exercise. So we call those thread the needles. So in that same tabletop position that I was in earlier. Yeah, he's going to work on some rotational movements. He's going to lift one arm up and he's going to open his body up towards the ceiling. Perfect. He can even let his gaze follow his hands nice flat, and then he is going to thread that same arm that's up towards the ceiling underneath his opposite arm to provide a counter stretch. Good, he can hold for about 5 seconds. And then he will repeat. And then he can repeat that up to 10 times. And then switch off to the other side. Good, it's important to remember here to move within that pain-free range. Nice, so mom, and he's going to stretch out the back of his hips next. Exercise 12. Figure 4 stretch. Awesome. With something called a figure 4 stretch. Awesome. So this stretches out a muscle called your piriformis, which is very important for some low back pain issues. You have a sciatic nerve that runs through it. And it also affects like the nerves that run down the back of your leg. So for anyone having tingling or numbness down the back of their leg, this one could be really good for you. So he's going to bend one knee up. Good. Yep, he's going to start off on his back and he's going to have both knees bent and he's going to cross his ankle over his knee. So within this position he's starting to stretch out his right side. Exactly, yep, that's it. And then he's going to take both arms and reach behind his leg that's on the ground, and then he's going to start to bring his legs towards his chest. Yeah, doing that stretch spot. Yeah, so you can hold that up to 30 seconds, kind of edge off, and repeat that up to 3 times and even switch sides. Exercise 13. Hamstring stretch. Is a hamstring stretch. So back pain is often associated with some neural tension, especially when your symptoms radiate down your leg. Something like sciatica. Another way to mobilize the nerves and reduce some of that tension is a dynamic hamstring stretch. So I'm going to lay on his back nice. He is going to reach him both hands behind one leg. Perfect, and he's going to slowly straighten out his knee. as much as he can. Perfect. And now he's going to bring his toes towards him. Good. And now he's going to reverse that process. So he's going to point and bend exactly. So he's going to repeat that up to 30 times. Perfect. Good. And it's a good way to get a good stretch in those hamstrings. How does that feel? It's just a good nice stretch that way. Nice. Alright, so that is that, and now we're gonna have man up and moving. Exercise 14. Squats. So we got some squats ready for him. Awesome. So squats are another classic lower body strengthening exercise. Some general guidelines. But if this is a motion, that's generally a squat that just works and feels best for you. So let's start with his feet underneath his hips. Perfect. So he's going to sit squat down as if he's sitting down into a chair. So go ahead, there he is. Yep. And he's going to work his way back up. Yep. Perfect. So it's important here to try to maintain that neutral spine the entire time. So I'm going to have him actually face off to the side. So try that again. Good. So we don't want his back arching too much. You want to try to keep that lower belly engaged as we do that. Much better. Nice. Exercise 15. A hip hinge. So a hip hinge is a great functional movement that carries over to whenever you have to bend down and pick something off the floor. So I'm actually going to start by kneeling. Good. So he's going to bring his hips back without having to hunch forward. Chest forward. Exactly. Yep. And then he's going to bring himself back. Exactly. So he's getting that like hip motion going. And then I'm going to have him work his way up to standing, and the same principles are going to apply. He's going to move his hips back without arching his back too far forward. Perfect. Good. Now if there's no pain, this is something that you can start to slowly load with light weights or anything you might have around the house. Thanks for listening. Power. Peace.